many patients with bladder cancer show up with more advanced disease. We know that there's considerable understaging of bladder cancer. About 40% of patients with muscle-invasive disease either have T3 disease or node-positive disease. Some patients even show up and already have positive lymph nodes or bulky disease with hydronephrosis, where we're concerned about non-organ confined disease. I think it's important to collaborate with medical oncologists and radiation oncologists to try to decide the optimal treatment for patients. Certainly in patients with positive lymph nodes, they already have evidence of non-organ confined disease, and they should start their initial treatment with chemotherapy in most cases if they're eligible. In patients who we find have advanced disease after chemotherapy and bladder removal, we need to consider whether or not they should get additional treatment. There are very promising adjuvant trials right now with immune checkpoint inhibitors that the patient should be considered for. One should also consider adjuvant radiation therapy for patients with positive margins because they may benefit, especially if they're at high risk for local failure.